Hey everyone, you probably remember us. I'm Dr. Mallory Hertz, physical therapist with Physical Therapy and Balance Centers. I specialize in pelvic health, and I have with me.
And I'm Nicole Hunt, and I'm a doula here in Sioux City, Iowa. And today we wanted to talk to you about how we are both adapting to the coronavirus pandemic.
It's kind of the elephant in the room. There's so much unknown and so much that continues to change, and I think excess appointments or things that aren't necessary to get out of the house for are becoming something people aren't accessing. But on the flip side, they need the services. So we've all had to get a little bit more creative in how to keep everyone safe, but also still provide the needed services. So Nicole, how have you adapted your practice around COVID-19?
Yeah, definitely having to be creative and flexible. As of this moment right now, private doulas are not able to offer in-person support at the hospital. So I'm offering virtual support for my clients, and that looks a little different, but it's just a lot more education side of it because doulas offer three types of support: informational, educational, and physical. And so the physical side of it is just being taught as education. And so instead of having that in-person meeting to see if we're fit, if you want to hire me as your doula, that's done over the phone. And the actual birth is done virtually as well, whether it's on FaceTime or speakerphone, whatever platform you want to use. That's what has been working the best so far with my clients. What about you, Mallory?
I just have one other leading question for you. Do you anticipate that that's going to be this way for a long time, or you're just kind of going with the flow and seeing what restrictions are and what the status of the virus is?
Yeah, I have to be flexible. I mean, I completely understand where the OBs and the hospital's point of view is they're trying to keep me safe. They're trying to keep their patients safe. I have little ones at home. I don't want to get sick. So I completely understand staying at home and not going up to the hospital. If that changes, just kind of have to play it by ear. It depends on, we're in uncharted territory. So it's really hard to say how this is what the future is gonna look like. But again, just being creative and being flexible.
Yeah,
I don't know what the punches.
absolutely. That's kind of what we're doing here as well. Some of physical therapy is meant to be manual work. We're actually using our hands and working with our patients. So when patients do come into the clinic, we are limiting the number of patients that are in our gym area at one time. All of the pelvic health patients are seen one-on-one in a treatment room. So it's me and the patient in the room. So we're limiting people in that capacity. We're doing our normal cleaning. We have always cleaned in between all of our patients. So everyone says, how much did Corona change things for you? And I wear a mask now. Everyone around the clinic wears a mask. We ask our patients to wear masks just so we can all help protect each other. We've always washed our hands. We've always cleaned. So that has continued. We maybe are a little more mindful of cleaning other areas better. I clean my computer a lot more often throughout the day instead of just daily. So we're doing extra things to protect patients when they come into the clinic. But then we also offer telehealth. Insurances right now are allowing us to meet virtually with our patients. So we would use a platform that's HIPAA compliant, and we can see our patients so we can have that face-to-face interaction. It just happens to be a virtual interaction. So for those patients who we feel like qualify for a telehealth appointment, we will go ahead and set that up. Most of my patients have been what I call a hybrid physical therapy treatment, and that means that some treatment sessions are telehealth while others are in the clinic. And we just go session by session and say, okay, so this is our plan for the next session. I think you would be appropriate to be seen through telehealth, and then we'll schedule it accordingly. So if patients are really leery of coming in, we are able to work around that and see them virtually as well.
Yeah, I mean, we don't know what normal is going to look like after this, but definitely just being flexible and just doing what you can to get around it is what's going to get us all through it.
Yeah, have to work outside of our normal box per se, but we just want to do what we can to get patients the help that they need. So if you have a concern and you need our services, just call. We'll try to figure out what we can make work that's best for you and best for us and keeping everyone safe.
Yeah. Thanks, guys, for tuning in.